Hi, I'm Dr. Jessica Hawks, and this is Just Ask Children's Answers from the Experts. I get asked a lot of questions about COVID-19 and how the pandemic has impacted youth mental health. And today I'm going to speak about that and about how parents can help. So let's start by talking about some of the unique challenges that youth and families have faced throughout the pandemic over the last couple of years. Certainly stress has been tremendous over the course of the last couple of years, and there's a number of reasons why that has happened. Certainly COVID-19 in and of itself has just been tremendously stressful as people have worried about potentially getting COVID or friends and family getting COVID and having to worry about their loved ones and the possible loss of people. School has been profoundly stressful for kids over the course of the last several years, as had worries about their future and what COVID might be doing to the prospects of going to college or getting a job. We've also been tremendously socially isolated. And if you think about youth in particular, their peers are the most important source of social support. And so very quickly and suddenly, their access to their peers got ripped away from them. And it's also been true for parents who have lost a lot of their meaningful sources of support as well. Youth have had to grieve the loss of a lot of important milestones. So for example, you go through school looking forward to that day when you get to walk across the stage and be able to shake hands and get your diploma. Seniors in high school didn't get a chance to do that at the onset of the pandemic, and that comes with a lot of grief. There's also been major disruptions in schedules for both kids and parents alike. So for kids, they had to go back and forth with virtual learning and home learning and going back to school, and that has a lot of disruptions. And then you add the layer of parents who were working from home and having to juggle both supporting their kids with this virtual learning as well as having to juggle all of the work meetings that they were trying to do. And it just caused a tremendous amount of stress and disruption to everybody. And if you take a step back and think about all the different hats that parents were wearing, teacher, educator, friend, therapist for their kids, the dynamics just inherently have had to change between parents and their kids. And this causes a lot of stress because all of a sudden parents aren't just being asked to be parents, they're being asked to be all these other things and set limits and have expectations that aren't typical of what the parent-child relationship has been about. And that's inevitably going to cause conflict. So when you think about all those challenges, it should come as no surprise that mental health has been impacted. And there's a number of things that we want to highlight today so that parents are aware of some of the things that youth are currently going through when it comes to their mental health. First and foremost, the prevalence rates of mental health concerns have skyrocketed. Rates of depression and anxiety in particular have doubled since the start of the pandemic. And we've been interested in understanding why that is. And so there have been a lot of surveys conducted with youth to ask them, what has been the most impactful thing to you with regards to worsening in your own mental health? And the number one factor that consistently comes up again and again is social isolation. And while, of course, that's upsetting because the pandemic has inherently caused a lot of social isolation, it's also really helpful and empowering information to know. Because if we know social isolation is one of the biggest causes, we know one of the things that we can do to try to help, and that's get our teens and our kids more connected to the social supports that they need. Unfortunately, as we've seen rates of anxiety and depression increase, we've also seen rates of suicide and suicidal ideation increase. And in fact, in our own emergency department, we have seen about a doubling in the amount of patients who have been presenting with suicidal ideation concerns in our emergency room. As a result, suicide is the number one cause of death for youth in the state of Colorado. In addition to mental health concerns for youth, we've also seen a significant rise in mental health concerns for parents. And in fact, a recent survey showed us that parents' own mental health concerns have raised by almost a third. And that's important to acknowledge because it's really difficult for us to be able to show up as parents in supporting our kids' mental health when we're also struggling. And so we need to think about that and how we can also address our own mental health and well-being. Recently, a lot of professional organizations across the country have recognized this alarming increase in the amount of mental health concerns that youth have had, and as a result have declared a national emergency for youth mental health concerns. And Children's Hospital Colorado has also declared this type of mental health emergency for the youth in the state of Colorado. So the first thing parents need to know is how to be able to effectively identify when your child might be having mental health difficulties. And so I want to share with you a list of some of the most common symptoms that kids and teens are going to present with that are red flags to suggest that there might be mental health concerns. The most important symptom for parents to be aware of is irritability. Oftentimes, youth depression doesn't show up in the ways that we think about depression typically, especially in adults, where it's more withdrawn and sadness and crying. Irritability is actually the way that depression oftentimes looks in kids. So if your child seems to have a shorter fuse or seems more tearful or more quickly to get upset about things than they typically did in the past, that's an important warning sign to pay attention to. Other type of warnings include intrusive thoughts or worries. And you can tell this as a parent when your kid is asking the same type of question again and again. It suggests that there's a lot going on inside their minds as well about those same concerns. Acting out in tantrums is another common way that kids show that they're having a hard time internally. Anytime you notice that your kid has had significant changes to their eating or sleeping patterns, that's something to take notice of. And this can include both a decrease or an increase in a need to eat or sleep. If they seem to be isolating more, that's an important thing to know. And it's hard to tease this apart because, of course, teenagers like to spend a lot of time in their room anyways, and that's normal. But if you notice a major shift, that even more so they seem to be spending time away from the family, that's concerning. And if they seem less motivated, that's another warning sign. So if you're noticing that your child doesn't seem as willing to engage in the kinds of things that they need to do, get their chores done, get their homework done, go to school, that can be alarming and something to notice. And then finally, if they don't seem to be enjoying the typical activities that you're used to seeing them enjoy, we want to check in with them, because if a kid typically likes to do sports or spend time with their friends and all of a sudden that changes, that's an indication that there might be something going on. So let's talk about how parents can help when their kids may be experiencing mental health concerns. There's a number of strategies that I want to talk to you about today that can be helpful. The first and most important thing that you can do as a parent to support your child's mental health is to talk with them. And I would encourage you to think about this as just an overall family culture of regular check-ins, bringing up difficult topics with your kids, and asking them how they're doing. One of the most common questions I get from parents is a worry that if they ask their kids if they're thinking about suicide, that might somehow be planting that idea in their head. And we know that the opposite is true. Please be reassured that asking your child if they're thinking about suicide is only going to open up an important conversation that you can have with your child and make sure that they're doing okay. And that if they're not, you can start to have a conversation about what you can do to help support them. Other things to be thinking about when you are trying to create this family culture of openness and communication is to be present. Put down the phones. Don't try to multitask when you're having these conversations. Just fully immerse yourself in the interaction that you're having with your child in that moment. And follow their lead. Ask open-ended questions. Don't come in necessarily with preconceived ideas and ask them very targeted questions. Just open it up by saying something like, "How are you doing?" And just see where they go with that, because a lot of times where we think as parents they might go is not in fact where they lead us. Other things you can think about is normalize and empathize. And what I mean by that is normalize that difficult things happen. Adversity is a normal part of life, and it's okay to have really difficult emotions that come alongside with that. It's okay to not always be okay. And once you start to have that conversation, try to infuse empathic statements throughout. And empathic statements can sound something like, "It sounds like you're feeling blank," and insert whatever emotion that you think they might be feeling. So it sounds like you're feeling really sad that you went back to school this week and your friend group doesn't seem to want to spend as much time with you. The great thing about empathizing is that you don't actually have to get the emotion right. Your kids will correct you if you get it wrong. But the important thing is that you're demonstrating that you're trying to connect with them and understand their experience. And then finally, empower them. Have a conversation that allows you to focus on the things that they actually have control over. There's a lot of things in kids' lives that they don't have control over, and it can feel really overwhelming if we focus on those. But there's always something in a situation that a youth can feel some control over, and that can help them to feel more empowered by what's going on. Another thing that parents can do is promote healthy coping. And there's a couple of key things that I want to highlight here that have been shown to really help promote an overall sense of well-being, both physically and emotionally. The first one is sleep. We all know that youth don't tend to have very regular sleep schedules. They like to stay up late, they like to sleep in, and for the most part, that can be okay. But when you're having a hard time with mental health, your sleep tends to get even more disrupted. So try to keep your kids on a regular sleep schedule. Plus or minus an hour, have them getting up at about the same time and going to bed about the same time, 7 days a week. We also want to think about what we're putting into our bodies. What are we eating? And really trying to promote an overall healthy, balanced diet. Kids are going to eat junk food, and that's okay. We just want to make sure that we're also throwing in some fruits and vegetables. Physical activity is a tremendously helpful strategy when it comes to mental health. So try to get your kids up and moving. In fact, there's been studies that have shown that simply getting cardio exercise on a regular basis actually improves certain hormones in our bodies in the same way that antidepressants can. So get yourself up and moving, and it will help your kids feel better. And then finally, we live in a gorgeous state that gets so much sunshine, and there's so many wonderful things to do outside. And there's actually been really clear connections between being outside and improved mental health. So try to support your kids in getting outside and enjoying those activities. Other things parents can do to help promote healthy coping includes encouraging what I call approach-oriented solutions. So if you think about any time a person experiences a negative emotion, it tends to prompt us to want to avoid, to get out of whatever that situation is, because the emotions that come up in that situation don't feel good. And so we tend to want to avoid those kinds of things. Unfortunately, what happens when we do that is we get ourselves into a bit of a vicious cycle, and it can actually create a downward spiral where we just feel worse and worse as we avoid more and more. So instead, we want to encourage our kids to approach difficult emotions, to be able to lean into difficult situations and conversations, because when we do that, more often than not, we realize that we actually are very strong and very resilient, and we have the ability to overcome the difficulties that are happening. And then finally, be a good role model. The number one way kids learn is by watching the important adults in their life. And so we want to show them what it means to engage in healthy coping. Do the same things that we just talked about when it comes to improving overall wellness and approaching difficult situations. When our kids see us doing that, they're going to be more likely to feel like they can do the same. There's a lot of things that we can also do as parents when it comes to just the way that we're parenting our kids and how it can impact the mental health and well-being of our kids. So the number one thing that we can do as parents is spend quality time together. Similar to what I talked about before, when you're spending quality time together, there's just going to be natural opportunities to check in and to continue to form those connections with your children. The number one way that we can motivate our kids is by the ways that we use our attention. Attention is the most powerful reinforcer that you have in your back pocket as a parent. So use that to your advantage to try to help motivate your kids to do the kinds of things that they need to do. And I like to think about this as catching them being good. So anytime that your child is engaging in the kinds of activities that you want to see them doing, notice that. Say something about it and really highlight how proud you are of them or how impressed you are with what they're doing. And the really cool thing is that the more you do that, the more often your kid is going to want to engage in those same behaviors because they like being noticed for the great things that they're doing. It's important when we're thinking about praise to really pay attention to what we're praising and try to praise efforts versus outcomes. In today's day and age, we are so focused on achieving and excelling, and our kids are actually feeling a lot of increased anxiety because of how much pressure that has been put on them to be the best at everything. And one of the ways that we can help to kind of fight back against that cultural norm is by not focusing so much on getting the straight A report card. It's on engaging in the learning experience and praising them for just immersing themselves in learning and not focusing so much on the grades themselves. Another question I've been asked a lot over the course of the pandemic is how and when to set limits, because as parents, we have felt so much guilt about the ways that the pandemic has negatively impacted our kids that we've been tempted to want to give them a lot more leeway because we're trying to compensate for all the things that we feel terrible that they've had to lose out on. And as a result, kids have had less boundaries and less structure over the last 2 years, and it's really understandable why that's happened. But I want you to know as a parent, it's okay to set limits with your kids. And in fact, that is a really important strategy to help promote the overall well-being of your child. So set limits on screen times, for example. It's okay to say, no, you can't spend 14 hours on your tablet today. You can set those limits and feel good about the fact that you're actually making things better for your child and their emotional well-being. And finally, use effective consequences. Similar to having consistent and regular expectations, it's okay to use consequences when your child is making choices that you don't agree with. The great thing about consequences is that we can use both reinforcement and consequences, or what we oftentimes refer to as punishments like timeout or taking away a privilege. The best way to motivate behavior is through reinforcement. So try to use those rewards to really promote engaging in good behaviors and use privileges to be able to motivate your kids' behaviors. But kids are inevitably going to engage in bad choices. And when that happens, use effective consequences like timeout for younger kids or taking away privileges for older kids. Here are a couple of resources that parents might want to take a look at. There's some really great apps out there. There's also important community resources to be aware of, including Children's Hospital Colorado, who has the entire continuum of mental health services available for your children. And then finally, there's a website called childmindinstitute.org that's got a lot of really great information on it for parents and helping to support their children's well-being.